Good evening, my name is Matt Kowalski, and today I'm going to talk about post-traumatic stress disorder. We have a gentleman by the name of Michael Wallace, who's a 35-year-old male. As a child, Michael came from a broken home. He lived primarily with his mother, who was active in her drug addiction, and as you can imagine, her home was very unstable. Although Michael visited his father occasionally, he was very emotionally detached. Throughout his childhood, Michael suffered physical, emotional, sexual, and spiritual abuse on many different occasions. Now, at the age of 35, Michael works his own business and is a very successful businessman. He's extremely goal-oriented and holds 2 college degrees. Any business associates would be completely unaware of Michael's past. However, his home life is a different story. Michael is married with 2 children, and he has extreme difficulty having intimacy in his relationships. His wife reports that Michael seems to go off into his own world. Michael attributes this to the constant flashbacks and intrusive thoughts that he reports of having on increasingly frequent basis. Michael reports being constantly on edge, waiting for the next shoe to drop, so to speak. Michael avoids discussing the past with his wife, and she reports knowing very little about his childhood. After seeking counseling, Michael has indeed been diagnosed with post-traumatic stress disorder. With proper assessment and diagnosis, PTSD can be treated effectively with eye movement desensitization and reprocessing. Today I will be discussing the causes of the disorder, the symptoms that are associated, and how EMDR can be used to treat it effectively. PTSD was brought to the mainstream media by soldiers returning from the Vietnam War. It was sometimes referred to as the war within, or combat PTSD. Many soldiers suffering long after the combat had ended needed to seek professional treatment to cope with the effects of the trauma that they encountered in their times in the wars. PTSD does not just affect war veterans and soldiers. People who have encountered natural disasters such as tornadoes, hurricanes, earthquakes, floods, also experience PTSD. The symptoms can occur immediately after the traumatic event, or may not even appear for months or sometimes years after that actually happened. When considering PTSD, there's one population that has been largely overlooked: children of abuse. Like Michael, are at high risk of developing PTSD. As children, and without the treatment, it can continue long into adulthood. In fact, sexual abuse survivors constitute the largest number of PTSD victims known. A person with PTSD tends to demonstrate many avoidance behaviors. They may avoid cues or situations associated with the trauma. They often re-experience the trauma in the form of intrusive memories, recurrent dreams, and flashbacks. PTSD victims may experience increased arousal, such as hypervigilance, which means always being on guard. They have disturbed sleep, irritability, angry outbursts, and difficulty concentrating on a daily basis. Using these symptoms, the American Psychological Association has created a guideline for DSM in order to diagnose PTSD effectively. Fortunately, eye movement desensitization and reprocessing has proven effective in treating PTSD. It was first introduced by Shapiro in 1989. Through EMDR, a client is able to process the components of the traumatic memories and experience and help relieve the symptoms associated. Dual attention stimuli enables the success of EMDR. This can be achieved through eye movements, just as the name suggests, but also works well with hand tapping or auditory stimulation. EMDR is an 8-phase process, beginning with the assessment, going through the actual procedure, and ending with a follow-up session. Through studies, EMDR has proven to be both effective, and while cognitive behavioral methods can require anywhere from 15 to 85 hours of therapy, EMDR is much more time efficient. In conclusion, I have discussed the various populations that are affected with post-traumatic stress disorder. I've discussed the symptoms of PTSD, and I've also showed you how EMDR can successfully treat this disorder. Here's a list of my references, who I've used, and at this time, I'd like to open it up for any questions.
Okay, I have a question. Are there any other treatments available for PTSD?
Any other? I'm glad you asked that. Yes, there is. Other treatments to treat PTSD include antidepressant medications, which prove to be helpful at times. EMDR and cognitive behavioral therapies are the most commonly used in treatment. Studies have shown both treatments to be beneficial in treating PTSD. However, with EMDR, the results and the achievement can usually be achieved in a rather quicker time, as a short amount of time. When just 8 sessions is shown to be very, very beneficial.
Do all abuse victims end up having PTSD?
No, not all. Matter of fact, the studies have shown probably about half of Americans who have experienced a traumatic event, a life-threatening event in their life, have experienced some type of symptoms, and less than that half who actually experience that trauma actually get the symptoms of PTSD. So it is a small percentage. Not everyone develops these symptoms of post-traumatic stress disorder. No, they don't.
Okay. Who can diagnose PTSD?
PTSD can be diagnosed by a healthcare provider or a mental health professional, such as a psychiatrist or psychologist, counselors, and that's it. And that's it for now. Thanks for the questions.